All right, good afternoon, everybody. I'm Greg Fisher, the mayor of Louisville, and thank you for joining us for our daily media briefing. It is a beautiful day here in Louisville. I want to start just by saying how grateful I am and how proud I am of the many, many people that are helping us get through this coronavirus COVID-19 time. It's really changed a lot of our worlds, everybody's world, but we're pulling together and getting it done. So I just want to say thank you to everybody that's doing their part out there. And, we should be able to enjoy a beautiful spring day like this, even in the most challenging times. And obviously, these are, in fact, challenging times for us. And I want to kind of start a little bit with just kind of the brutal reality of what it is that we're addressing here that everybody has got to be aware of by now. Nationally, obviously, the news is not good. We see the images coming out of New York City and other cities right now that are just showing us how difficult this challenge is to get through COVID-19 and keep our healthcare systems up. This is not just a health challenge, it's an economic and financial challenge as well. 10 million jobs have been lost so far in our country. Help is on the way from the federal government with some of their programs, but it is brutal when this many jobs are lost. And almost 6,000 people have died now across our country. So while we're always going to maintain hope and we're going to work through this, I think understanding this kind of hardcore reality we're dealing with motivates us even more to do our own part to make sure that we're not spreading this disease. I know that we are resilient people, we are compassionate people, and we will do what it takes to get through this, and we will get through it, and we will only do it by getting through it together. So let's confront the brutal reality with hope and individual action to be part of the solution. Now let's take a look at the data of where we're at for today. As of the most recent update, there are 241 positive COVID-19 cases in Jefferson County. I want to sadly announce that there is one additional death. So the total number of people who've been lost to COVID-19 so far in our city is 9. When you think about the death and the family impact, the friends impact, but additionally now, if you read the obituaries and if you see what's happening with these folks here, we can't have funerals now to mourn the people that are passing. And that's an important step for so many of us to mark that kind of passage in the community. And if you're a family and your friend and you want to celebrate the life of that loved one, it's very difficult right now to not have those traditions that we normally have in our society. So it's another impact of what we're seeing here. So my heart goes out to everybody that's going through this very difficult time right now. This is not a competition either here. So, I am encouraged that we're not seeing the kind of dramatic rise that we're seeing in other cities, in other states right now. But I also am realistic. Test results are not the ultimate measure of what the status is of this virus in our community because we don't have enough test kits, number one. And what we're really tracking is the number of cases coming into our hospital system. That's largely stable, goes up a little bit, comes back a little bit, but we're not seeing any kind of run on our hospital system right now. So that just means that we have not experienced our peak. Or our goal obviously is to keep our peak low and extend it over time so that our healthcare system does not get overrun. We spoke about that this morning. We had a Facebook town hall at 10 o'clock this morning with representatives from Norton Baptist Health and University of Louisville Hospital. We've got a great, resilient healthcare system in our city, and we've been working with these partners for years on simulations and practices with different scenarios that we could be planning for. And when you're going through these tabletop planning sessions that we have, it's always some kind of scenarios. It could be a small scenario, it could be some kind of worst case scenario. But none of us, even though we've practiced for this, did we really think that we would have a pandemic? The last one was 100 years ago. So it's back on us. So I'm very grateful that we've been practicing for a situation like this that now is real and our collaboration is strong. If you were on or saw our teletown hall this morning, you could certainly feel that amongst our partners. So I'm grateful for their collaboration and the clear message that they're giving to all of us, which is while they're on the front lines delivering health care everybody produces a healthy city. And what we can all do is stay home so that our healthcare system is not being overwhelmed, so that we don't have more people dying in our community because of reckless behavior on anybody's behalf. So I want to say thank you to Norton Baptist and U of L healthcare systems for joining the call earlier today, for everybody that's on the front line of our healthcare systems, from the janitors to the doctors. Thank you for what you're doing. We've got your back as a community. The message of staying home, now obviously we're seeing that showing up in the data in terms of effectiveness. It's the logical conclusion that everybody is coming to when you review what's happening all over the world, and you see communities that were way too late in limiting mobility, and those that started early are seeing much better results. So we're constantly looking at local and national and global sources to learn, to look at their data. And while the numbers and projections vary, it all tells us the same basic story. If we stay home, we can and we will limit the spread of COVID-19. Stay home, stay home, stay home. For example, the New York Times reports on a company called Cubic. I've referred a couple different companies that are measuring data mobility, and Cubic anonymizes mobility data from cell phones. And Cubic looked at reduction in travel by counties around the country for this last month of February 28th to March the 27th. By and large, we know that the less we're traveling, the less we're going to be interacting with people, right? That's logical. And so the less we spread the disease. So we don't want you to travel. Cubic just released their latest findings, and it says that in Jefferson County, we reduced our travel by 74% over that month. And that sounds like a lot, right? But you can see here on this graphic where each of the bubbles represents a county that's under a stay-at-home order, which includes all of Kentucky counties. That's been ordered by Governor Beshear. So these are the ones that are stay-at-home. If we included all of the counties in America that weren't stay-at-home, these results might look a little bit different. But what you can see is, compared to other counties that are under stay-at-home shelters, we are underperforming. Okay, we are below average. So if you're to the right of the average line, it means you are not changing your distances traveled as much as if you're to the left. So what this shows us is that we still have progress to do to get better. Okay, so this is measuring us, and while we're seeing good results locally, we can be much, much better. So it's always good to take a look at data like that. And we looked at another set of similar data a few days ago where we had better results. Okay, so it's going to go up and down. The measure of this is, are we all doing what we can? Okay, these things are going to change day by day, and we have to be better. We have to adapt. We have to all stay home and move around as little as possible. In this article, it quotes Aaron King, who's a University of Michigan professor who studies infectious diseases. And when he was talking about the overall reduction in mobility, his quote was, "By any measure, this is a massive change in behavior. And if we can make a similar reduction in the number of contacts that we make, every indication is that we can beat this epidemic." Okay, so what we're talking about there is less travel and then less interacting with people. So the bottom line, folks, is we got to restrict mobility even more to beat this disease, to keep you safe, to keep your loved ones safe, to limit illness and limit death in our community. So stay home even more. Take it to the next level, right? It's like when you're exercising and you feel like, I'm doing pretty good, but you can go to the next level and you got to push yourself. And this is what we got to do right now in our community to limit our contacts to the bare minimum necessary to sustain life. So that means when you're thinking about planning your day and planning your week, if you're talking about what kind of food and medicine do I need for the week, don't go every day. Plan it to go once a week. So that reduces your interaction with people by 7-fold. So imagine how that ripples throughout the community in terms of limiting the ability of the virus to spread. If you are doing things or have things planned right now to say, like we're going to have a family party, it's going to be okay. The family, we can get together. This is a time right now where I'm asking you not to do that. And I know that is really hard. I have not seen my parents in like 3 weeks now, and I miss them. I check in with them every night. Uh, some of our kids that live around here, relatives, haven't seen them either, but we're checking in. Okay, so cancel any of those things you have. Figure out a way to do it online through a Skype or a Zoom or somewhere like that, and add that kind of new skill to the repertoire of your family. So it is difficult. Young folks, you're saying I'm just going to hang out with my buddy and he doesn't have the virus, so I don't have anything to worry about. Remember, many of the carriers are asymptomatic. That means you don't have symptoms, but you're spreading the disease. So please help us cancel all of these type of things. If you have to go to your workplace because you work in a designated life-sustaining business, an essential business is defined by the governor and Homeland Security, do everything you can to keep 6 feet away from other people at all times. Remember, if you can breathe on somebody, cough on somebody, sneeze on somebody, you are too close. All right? So going out to keeping 6 feet, that includes public spaces. We want people to go out and get some fresh air and get some exercise. It's good for your physical and mental health. So if you're going to go exercise in one of our parks, our golf courses, go down to Waterfront Park, stroll across the Big Four Bridge, those are still open, but we can only keep them open if they're used safely. The weather's starting to warm up, so we're going to have a big test here when people get a little cabin fever and want to go out. I want to remind you, please do not go out and gather in groups. And this is kind of our last test here on these next couple of days to see if our community can keep it together without me having to restrict movement even more, close parks, close the Big Four Bridge. I don't want to do that. But if people are gathering together, I will do that for the safety of the community. If we see drag racing going on, we will take steps to seize your cars if you're doing that. So this is just way beyond any funny business or people thinking rules don't apply to them. This is how the virus spreads, and we will do everything that we legally can to stop that so that we can all live long and healthy lives. Okay, that's my job to try to maximize that in the community, and I will not hesitate to take any action to get that done. But obviously, I'm asking for the community to work with me and work with each other so we don't have to get it done. And the vast majority of the community is doing it, and I'm proud of that. I'm grateful for that. But we just got to stop this outlier behavior because this virus can spread very quickly and exponentially through lots of folks. Okay, so for the vast majority of our city, 99%, thank you, thank you. Now let's work on everybody else to get them in compliance. Okay, so we are on the right track and we're doing the right things. We just got to do what it takes to take care of everybody. Now, a part of that is making sure our workforces are safe. So I'm going to switch things up a little bit today as it relates to the health report. We usually have a public health update right now. Today we're going to talk about health inspections. There's a lot of questions about the health inspection process for businesses as we deal with this virus and non-essential businesses that have been closed by Governor Beshear, who continues to do a great job, by the way. Our Department of Public Health and Wellness has gotten more than 1,100 complaints about non-compliant businesses. You recall sometime last week we set up 311 where people could call in concerns around non-compliant businesses that were not keeping social distancing in place or people when they were gathering in a non-compliant way. So we thought it'd be good to feature our health inspection process today. Connie Mendel is with us, and she's the Deputy Director at Public Health and Wellness. She heads our Division of Environmental Health and Emergency Preparedness. She is one of the many heroes that we have that work for Louisville Metro government that nobody had any idea who they were other than friends or family before this virus took place. Now Connie is on the front lines. She's a public figure as a hero for the city, as a shero for the city, getting it done. So Connie, tell us about what you're seeing and what your team is doing. Appreciate you.
Thank you. So as you said, we had just over 1,100 complaints this morning. What we're doing as we receive those calls in from Metro Call, we're assigning those to staff by geographic region and investigating. Typically, we're getting them resolved in 1 to 3 days. Each complaint's handled on a case-by-case basis. Initially, what we'll do is reach out to the business by phone, by email, via social media, whatever method we can use. We'll advise them of the complaint, discuss their current operations, and educate them on proper procedures. So if it's a business that is non-essential and not allowed to be open, we will issue orders to close. If they're unwilling to operate safely, then we may also issue orders to close for even essential businesses. They must also still operate safely. So the most frequent complaints that we're getting basically are non-essential businesses that should be closed. We're getting some on essential businesses and even residential areas that are not following the social distancing requirements, like what you had mentioned, where we've got groups of people gathering in businesses or residential areas, and those have been apartments, parks, house parties, unfortunately. We get complaints on essential businesses not following good sanitation practices. And maybe there's a lack of hand washing facilities available or lack of disinfectant or hand sanitizer. We've gotten some concerns from employees who say that they've been forced to work while sick, or that they're working with a coworker who is sick. And some of the calls we're receiving are about businesses that are not using gloves. Now, and these are actually what we would consider a non-valid complaint. For instance, for those food delivery, if you're going curbside or you're picking up your food at a restaurant, they're not required to wear gloves. As long as they're utilizing good hand washing practices, that's okay. So what we do is we prioritize these complaints based on multiple calls and those that we consider urgent. So what we consider urgent would be a business that has a confirmed COVID-19 individual associated with the business or that location, so such as an employee, or if we have a suspect person or individual associated with that business. We're also prioritizing those that areas that would be the potential for numerous people to be exposed, so larger operations, and then again, if we're getting multiple complaints. Based on our conversations with the businesses, or if we're unable to reach them by phone, we will conduct a complaint investigation. So to date, most of everything has gone very positively. People are very receptive. We're able to educate people. We have had to issue 7 closures. And I want to thank Shively Police is helping us with some evening events, some entertainment venues there, and some of it is adult entertainment venues or late at night. LMPD is doing a great job helping us with a lot of complaints we're getting in residential areas, and ABC is helping us along with those that are, again, more evening calls where there's alcohol beverage involved. So based on what our inspectors are seeing, we do have some tips for what are considered essential businesses. So these are essential businesses we recommend you following, and it's going to help us get through this. And that would be ensure that employees that are sick stay at home. And even pre-screen employees and or customers, patrons, or visitors that come into your business. So the pre-screening would be a temperature, and even asking some questions as they arrive or before they arrive to work. So ask, have you been sick? Has someone in your house been sick? Has the health department or a different health provider reached out to you saying that you could potentially have been exposed? Have you had any travel recently? Or specifically ask them, fever, chills, cough, these type of things. We want to provide employees adequate space and or barriers to maintain social distancing while they're working. If you need to, remove chairs in waiting areas or other work areas. Separate chairs, workstations, or desks. Move those at least 6 feet apart. And if they can't be moved, if it's more permanent furniture, then block those off. So assign one of your staff to actually monitor everyone else and ensure social distancing. As we talked about yesterday, we're very social people. We like to gather, we like to communicate. So just having someone like a hall monitor go around and try to keep people apart. Um, if you're a business, an essential business that have people waiting in line, we're encouraging you to mark off 6 foot distances. Painter's tape is great for this on hard surfaces, or you could do a more permanent paint. If you have people that come into your establishment, then again, remind them to be 6 feet apart. Only let the amount of people that you can accommodate at one time safely in. Restrict everyone else outdoors. Have them wait in their cars if possible. And ensure your employees remain 6 feet apart from any of your patrons or customers. So we want to make sure that we're following guidelines if you do have a sick employee before they come to work. So we want to follow CDC guidelines on that. We'd like to see frequent cleaning surfaces, particularly high traffic areas, those visible surfaces that are regularly touched. And that includes countertops, doorknobs, and light switches and handles, vending areas. If it's in a workplace, where people clock into work, anywhere where people tend to gather. We want to see regular and thorough hand washing. We want to use soap and water. We always prefer hand washing over hand sanitizer, but also have hand sanitizer available. We want to see soap and water cleaning those high touch areas. Allow staff extra time to wash their hands. Post signs around your business. There's the required signs that the governor's office provided about stop before you enter the building if you've been sick. Post signs of, asking people to social distance and be 6 feet away. And we're also asking businesses to have a plan in place if someone does become sick. So that's what we're going to do. So I'm going to end there, but I'm available for any questions.
Thanks, Connie. Appreciate the good work of you and your team and getting after it.
Yeah.
You're a good public servant. Thank you.
Thank you.
All right. Connie will be on the call if there's any questions for her later. And then Dr. Moyer is also on the call if there's any other health-related questions for her. Well, we've talked about, the challenge that we're going through right now. But I tell you, my experience in life has been, when there's challenges and when there's dark days, there's always a lot of good things going on as well. And sometimes it's hard to see because you're so caught in the funk that you can't really take a deep breath and look around. But you don't have to look around very far to see a lot of good things going on. And one of the really bright spots in this period has been the incredible success of the One Louisville COVID-19 Response Fund. You recall we created that to provide financial assistance for folks that have been really smacked by this COVID-19 pandemic, financially hurt. So it's for eligible households and community organizations that people said, hey, we want to help them. And in the first 2 weeks, we raised about $7.5 million. So we came up with the idea on a Saturday, had the bank account opened quickly over the weekend. Fifth Third helped us on that. And then on that next Wednesday, we announced $3.6 million. Well, we're at $7.5 million right now. We recently announced support for 128 families through the fund that have gotten direct assistance for their bills. And we look forward to supporting like hundreds of more families. I've seen some of the remarks from people that have gotten the assistance, and it's like, this is what it's all about, helping people in times of need and at all times. So we're going to help hundreds of more families out there. On the nonprofit side, we just announced a couple of days ago the first round of grants to 17 of our outstanding nonprofits here in the community. So groups like Community Ministries, Louisville Urban League, Dare to Care, La Casita, and many, many more of them. So the news today for One Louisville is for the nonprofits in the community. If you weren't in the first round, remember we're focused on those groups that are helping the most vulnerable, but we've heard from some people that were like, hey, why didn't we get those first grants? Those first grants were decided by our grant committee that I'm not one of. And so the grants were driven by data coming into the community through 211, through 311, through United Community Software. So that was the first set of data. But we're launching a new application process. You'll recall that's what we announced when we put all this together, but we wanted to get some money quickly into the community. So that's why we announced the 17 the other day. So nonprofit community organizations can apply for funding through the Louisville website, louisvilleky.gov. Just go to louisvilleky.gov. The top left, you'll see COVID-19 apply or donate. Click there, and then you'll go and see how you can apply for some of these grants for nonprofits and individuals. Okay, so louisvilleky.gov is where you go. We will be announcing the next round of community grants on Monday, so April the 6th. Okay, so again, they won't be going through that process, but those will be other groups where the data shows we can help the most amount of people and the most amount of need in the quickest amount of time. And so we know the needs in the community they're great, they're immediate. We have thousands of nonprofits that are doing incredible work for the city every day. I know many of you all out there that you're supporting families, supporting organizations that needs help. So that's why we're going to this next step. We've streamlined the application process to get these funds into the hands of eligible people and organizations as quickly as they possibly can. I want to say thank you to some more Metro government heroes. Joe Lord in our communications team and Scott Render in our IT department are responsible for keeping our website up to date and current. There is so much information flowing in every day. These guys have been doing an incredible work. Just adjusting the website today in the matter of hours to get this new information up. This is the kind of pace that they're working at right now. So Joe and Scott, if you guys are listening, and everybody in the communications team and everybody in our IT area, I just want to say thank you. This is the type of stuff where people say our city government is getting done. They're there for us, and it's happening. So good job to you guys. Switching topics. Before I was mayor, I did not have much experience with people in recovery, especially in the business of delivering recovery services. And I've got to tell you, that has been one of the greatest gifts that I've received being your mayor, is to see folks that have struggled with substance misuse, could be alcohol, it could be drugs, but then say, I'm going to fight to get to the other side of it. And the people that deliver those services are super inspiring. And I'm saying there's nothing more clear to me than when you see somebody that's in recovery and you see the clarity in their eyes and the conviction that they have to fight the demon of addiction and really help out. So it's been a real blessing for me to get to know our recovery industry and our folks better in that. They're so dedicated. Obviously, when you're in recovery, it can be a mental health challenge for you. So we're focusing on mental health as part of our daily briefings. And today, we wanted to focus on recovery because one of our duties at city government is thinking about how this crisis affects people who are already in challenging circumstances. And that obviously includes our friends and neighbors and family members who are in recovery from substance use disorder. That has been a passion of mine since I've gotten in Metro government. It's been a passion of my teams as well. When the opioid crisis came through here, we were all over that as best we could. Still hadn't left the community. It's much better. But we released a plan called A Plan for Hope, Healing, and Recovery 2 years ago. And we've been seeing some positive results of that. Nowhere near where we need to be. But now with COVID-19, we have to think about how we as a community address the needs of people in recovery today, because it's become more difficult because a lot of recovery practices are people getting together and affirming their journey through recovery. So I'm pleased to be joined by Jenny Kelly today. Jenny leads the local chapter of Young People in Recovery. She's like fires you up when you talk to her and see the possibilities that are out there and how she has really changed so many people's lives. So Jenny, thanks for joining us. Tell us how we can help today.
Thank you for having me. My name is Jenny Kelly, and I'm a person in long-term recovery. And I've met you, Mayor Fisher, a few times, and just really respect your open-mindedness towards people in recovery because we need support. I have over 12 years abstinence from any alcohol or substances, and actually have the privilege of working in healthcare now. So I'm kind of being affected personally from all angles. But the brightest spot in my life is being able to extend my hand and to offer hope for people who are struggling because I've been there. It's a beautiful thing knowing that there are more than 23 million Americans living in long-term recovery, and our recovery community here in Louisville is absolutely resilient. Been able to personally experience several live virtual meetings, mutual aid meetings, all recovery meetings. And I'm just so excited that that is an option for us because the disease of substance use disorder and alcohol use disorder feeds off of that isolation and that feeling of desperate loneliness and dealing with the mental health aspect. So it's a beautiful thing to be able to just change gears and shift to a virtual social network. I actually moved to South Florida in 2007 and was able to connect with a recovery community down there as well as the people that started a website called intherooms.com, and that has been going for a decade now or so. But it's amazing how it was already established and now can help anyone to be able to access free mutual aid meetings, every single support group you can imagine. This is not even just for people in recovery from substance use. It's for anybody that needs support, and we all need support. And I've also been able to get involved with the Louisville Recovery Community Connection, and we have a website that is local. It's LouisvilleRecoveryConnection.org, and actually are going to be live streaming an open mic night tonight. You can find that on the website, and it really is like anyone can come in from their living room and play their guitar, sing poetry. We have a lot to offer. And I get to see this amazing resiliency throughout this community, and it really brings me a lot of hope. And just so thankful for the spirit of community and the unity that is brought about with recovery.
Thanks, Jenny. And oh yeah, no, we know each other, and yeah, congratulations on 12 years of sobriety. It's a huge step, and many, many more I know ahead. So thanks for just being with us today and giving some folks some resources in the community. So let us know what more we can do as we use these platforms and others to communicate. But proud of you and everybody in recovery, and for those maybe that are thinking about it and are about ready to make that call, would you have any suggestions for them?
Yes, it is such a better way of living. We get these amazing coping skills that I almost feel that the entire world could really use right about now. And that's what I was talking about last night on a meeting. Like we get a set of tools and a support network and all of these this lifestyle and design for living that really has brought about like the sense of purpose and stability, even though I'm personally quarantined at home right now from an exposure at work, but I don't feel alone because of these awesome relationships I've made through the years.
So if you're out there and you're thinking about it and you're saying maybe it's my time, make the call. it's your time. There's an amazing network of people that are there to support you. So, Jenny, thanks for being part of that. We appreciate you being a great citizen. Good job. Okay, so we're wrapping up here. One more announcement. I mentioned earlier that we sadly lost another person to COVID-19. We've had 9 deaths in our community so far, and almost 6,000 nationwide and counting. To honor all these folks that have lost their lives and are fighting the battle right now, green, the color of compassion, uh, is going to be installed in and around Metro Hall, as they already are on the City Hall clock tower, the Big Four Bridge that you can see here, and many other places, including homes throughout the community and our country. And we'll be shining green lights in honor of our COVID-19 victims every night. And I want to thank the people in our community that are already doing this. We're proud as an international model city of compassion. So this is just one more way that we can show it and remind us that we can all be compassionate and have compassionate acts toward each other each and every day. No charge to it. What you get out of it's a big smile on your face and a big warm heart. So let's keep our good compassion work going. Another way, obviously, to honor the folks that have lost their lives to COVID-19 is to keep everything you can do from spreading the disease. I know you're probably tired of hearing that, but until I see everybody in the community 6 feet apart from each other, I'm going to keep mentioning that at every opportunity. All right, let's say close on a Lift Up Louisville. As I mentioned, there's a lot of challenges, but a lot of beautiful things out here today. It would be nice to be walking around at the zoo today, wouldn't it? But we had to close the zoo because people congregate there. But our friends in the animal kingdom, outside the human animals, they're not aware of this virus going on. They're looking for everybody. So we thought we'd be joined by Malika today. She just recently turned 23, and Malika has a minor skin condition, but her keeper, Sylvia, another great Louisville Metro employee, found just the right brush to soothe her at an auto store of all places. And Sylvia has gone out of her way to make sure Malika has the best care, and she's enjoying what she does. She loves being brushed and eating oranges. So we're happy to wish Malika a belated happy birthday as one of our fellow beings here on the planet. So nice job to everybody at the zoo. You think about all the different jobs that you have when you work for local government. It's everybody from a police officer to somebody that's out riding on the back of a garbage truck to somebody that's taking care of our giraffes at the zoo. I appreciate all of them. They do a great, great job. So thanks to everybody at the zoo, John Walzak and your entire team. You guys are amazing as well. All right, folks. So let's just keep doing everything we can. Getting social distancing, washing hands. Don't go around people that are sick. If you're sick, isolate yourself to the best you can. If you have the virus, definitely isolate yourself and use your healthcare providers to get the best direction that you have. And reach out socially on the web. Join our Lift Up Louisville sessions. They're online every day, and you can explore the zoo virtually, as a matter of fact, by going to Lift Up Lou. You can get some workout tips. You can get first aid. You can learn cooking, singing. Got some real surprises coming up for us here pretty soon. And tonight at 7 o'clock, like every night, we have a mindfulness session. Tonight's about being calm, positive, and connected. And that's being presented by our friends at Global Game Changers. Thank you, Jan Helson. And I would rather be reading. So that's going to be the featured mindfulness activity tonight. So check that out. And remember, the census, 2020 census is going on. So you can complete your census online by going to my2020census.gov or on the phone, or you can mail it in as well. But we got to be counted so we get our adequate money of federal funds. Our census results drives how much money flows into the community from the federal government. All right, so for that now, let's go to our questions. First up to you, Dr. Moyer. There's more and more questions about masks, and should we all be wearing masks, and what are the specifications they need to follow for people to make masks? What good does it do if you have a cotton mask that's made versus mask that you need in the hospital? So just bring us up to date on all the stuff that's going on about masks and questions that are being asked about that.
Yes, so good timing. Lots of questions coming in about masks. So right now, big shortage of masks, surgical masks, N95, and so those that we're saving for our healthcare providers and other essential workers that we need to keep on the workforce. Cloth masks, there is a big debate out in the medical community, public health community, on whether or not they are beneficial or not. So some of the things that they help with is definitely if you're sick, if you're coughing, it helps stop some of the particles and the droplets from going onto surfaces and onto other people. And so there's some thought that that does help stop the spread of COVID-19. It also just shows the seriousness of this issue. And so encourage people to wear masks, cloth masks for that reason. But there's also some concern that it might increase risk of infection because it gives people a false sense of protection. It does not filter out all the particles. Even our surgical masks don't do that. And so there's a fear that people will leave their house and stop practicing social distancing if we start encouraging masks. And then there's also the concern that people will be touching their face more and adjusting it because masks are hot, they're itchy, they're not comfortable. So there's also the concern that we might be spreading more COVID if we encourage it. So I know the CDC is looking into it in depth right now, and so hoping for some more recommendations to come out in the near future. Until then, I don't have any recommendations on exact how to make them, but I would just say stay tuned, and it's something the entire world's looking at right now.
Thank you, Dr. Moyer. There's a question on here to me about GE. GE Appliances has ordered thousands of face masks for workers, and they're also donating a portion to hospitals. With the PPE shortage among healthcare workers, what do you think of GE Appliances face mask stock? Well, I certainly appreciate the fact that they're donating a portion to hospitals, but one of the best practices for businesses is to have masks to drive down the spread of the virus as well. So we encourage that at companies that have to be working because they're essential businesses right now. So it's important that employees have the opportunity to have a mask and they have a location where they can be isolated if they start feeling ill until they get removed from the premises in a safe way. So thanks to GE for donating the mask and protecting their workers also. And there's different kind of masks, right? I mean, the N95 masks are the ones that are used in the healthcare profession that are so important for us to have. Every day that we can limit the peak is one day closer to us getting more PPE in the community as well. So that's a way that we can all contribute to making sure that we have enough personal protective gear in the community. Okay. This next question has to do with specific individual questions about people that have been affected and have passed. So I'll throw this back to you, Dr. Moore. The question is, can we get some clarity of the 4 deaths reported on March 31st? Which one was the March 23rd passing? And do we know yet the demographics of the death reported yesterday on April 1st? Questions are being asked because we're seeing more and more stories from other cities that humanize these victims. They put a face on the human toll of this crisis. So why do you think we haven't identified these folks in our city? And do we think it's because there's a stigma associated with it? And is there a concern that as these victims remain nameless and faceless, that the people in Louisville will get antsy with public health restrictions and stop following them?
Lots of questions there. So one, just to clarify on releasing information. So as public health, we like to, or required to release any information that would change either our recommendations from public health practitioners or affect the public, something the public needs to know if they're at risk. So for all these cases, all of our deaths have fallen into what I've been talking about for high risk categories. So all of them are over 60 and have had chronic medical conditions. And so it hasn't changed the messaging, and so haven't felt the need to divulge any more details on that. And so putting that on the family member, or if they want to share any more details and put a face to that, all of them are humans, and we are very sad to have lost members of our community. But just as a health expert, there's not any more information that needs to be shared to protect the health of the community.
All right, thank you about that. Question about Metro Corrections. Have any of the Metro Correction workers been quarantined and or in connection with yesterday's positive case? So that's one question. I know that corrections is following CDC guidance on dealing with staff who've been in contact with anyone with the virus. Do you want to add anything to that, Dr. Moyer? Any Metro correction?
Just the tests that are still pending as far as I know right now. And then the contact investigation is back on to corrections. And so hopefully, haven't heard anything officially yet, but I'm guessing that they've been following great just social distancing of the 6 feet. And so hopefully there's not too many people that will be identified as needing to go into quarantine.
But those that
those that fall into our quarantine categories of within 6 feet for 20 minutes or more will be put on quarantine, and we will follow them.
And the inmates, the question, have any inmates been tested positive? Yesterday there were 6 pending cases, and we can say that there are no inmates with confirmed cases right now. So if that changes, we'll certainly let you know. Okay. Let's see. Okay, Dr. Moyer, other counties in Kentucky appear to be using sheriff's deputies stationed outside the houses of people in forced quarantine or isolation by court order. Why did Louisville opt to use ankle monitor tracking? If people don't obey rules, even with the monitor, will the monitoring practices escalate? Want to take that one? Or?
Sure. So, I mean, I think it's just a question of resources. We felt that the ankle monitoring will help us track it without using resources we don't need to use. And so far, they've all been obeying with the ankle monitoring, and so we have not had to escalate, but we do have a process procedure in place if that does need to happen, and just hoping I won't ever have to use it.
Great. Okay, that's the end of our questions here. So I want to thank everybody for joining us here on this beautiful spring day, April the 2nd. Continue to say thank you to everybody in the community that's helping us get through this, recognizing this is a huge change in people's lives, but the resilience that everybody's showing and the teamwork that everybody's showing has never been more important. So thank you to everybody for doing that. We will get through this together, one day at a time. And please join us tomorrow at 4 o'clock for the city update. Take care.